Welcome, everyone. Thank you for joining us today. My name is Mark Bautis, and over the next 30 minutes or so, we're going to talk about some of the things you need to know about healthcare when planning for your retirement, and especially about transitioning over to Medicare. The bars on this chart can be seen as separate health insurance systems. You might imagine them as silos. While you're working, you get your health insurance through your employer, the big silo on the left. When you leave your job, you'll move over to one of the other silos, most likely Medicare. Or if you retire before age 65, you'll move to the individual health insurance silo. When you're used to getting your health insurance through one of these silos, it can be disrupting to move on to one of the other silos. You have to get used to a whole new system of healthcare. That's why we're talking about today how to transition from employer insurance over to Medicare. It's not as easy as you may think. The retirement healthcare challenge can be really thought of three separate and fairly complicated issues. First, you want to make a smooth transition from your employer insurance to Medicare. This means avoiding late enrollment penalties, avoiding coverage gaps when you go from one insurance to another, and making sure you have adequate coverage. Medicare doesn't cover everything, so you'll want to find the right kind of insurance to fill the gaps and cover your prescription drugs. Second, you'll want to understand your first year healthcare costs. While you're working, your insurance premiums are being subsidized by your employer. If you pay a portion of the premiums, they're coming directly out of your paycheck, so you may not be aware of how much you're paying. Once you do retire, you're on your own. You'll be paying the premiums yourself, and you'll need to budget for them. Finally, you want to start thinking about your lifetime healthcare expenses, including long-term care. As you age through retirement, healthcare costs will continue to rise, and you may need more care as you get older. So it'll be important to plan for these higher expenses down the road. The amount you budget for healthcare in your first year of retirement will probably go up in the years ahead. Which brings us to our agenda for today. First, we'll talk about how Medicare works with employer insurance. We showed Medicare in its own separate silo from employer insurance, but there's a little bit of overlap, and you'll want to understand how that works. Second, who needs to enroll in Medicare and when? We'll cover the circumstances that dictate when you need to enroll in Medicare. Third, we'll tell you how to enroll in Medicare. We'll discuss how private insurance works with Medicare to provide complete coverage. And we'll show you a sample budget to assist you in creating your own. Our overreaching message here is that people should not retire until they know how they're going to pay for healthcare in retirement. Okay, so let's start by talking about how Medicare works with employer insurance. This table may help you understand how your healthcare bills get paid. Right now, while you're working, your doctor sends your bills to your group health plan and they get paid. When there are two insurance companies involved, such as a group health plan and Medicare, there's a primary payer and a secondary payer. The primary payer pays up to its limits, and then the bill is sent over to the secondary payer. If you're still working and covered by a group health plan that covers 20 or more employees, the group health plan pays first. If you're also enrolled in Medicare, and if the bill is not fully covered by the group health plan, Medicare will pay its portion up to its limits. Here's what's important about this table. If you're covered by a group health plan that covers fewer than 20 employees, or if it's a retiree plan or COBRA, Medicare pays first and the other plan pays second. But in order for Medicare to pay, you must be enrolled in Medicare. If you aren't, your other insurance may not pay its share, meaning you effectively do not have health insurance. So that's why it's really important to know when you need to enroll in Medicare and to do it on time. Okay, so who needs to enroll in Medicare and when? Let's consider the different circumstances. If you're under 65 and still working, there's nothing yet for you to do. You'll simply continue with your employer plan and you'll not enroll in Medicare yet. You are not eligible for Medicare until you turn 65. If you're under 65 and retired, you're not eligible for Medicare yet. You'll have to get your health insurance from some other source. Maybe your employer offers a retiree plan, or maybe your spouse is still working and you can be covered under their plan. If employer coverage isn't available to you, you can buy health insurance on your state insurance exchange. You may or may not get a subsidy depending on your income. If you are working, it starts to get complicated. If you're over 65 and still working, first ask, does the employer plan cover 20 or more employees? If yes, you can stay on the employer plan and delay enrolling in Medicare. However, you should talk to your benefits administrator to see if you should enroll in any part of Medicare. You may be advised to enroll in Part A because it's free and it generally offers better hospital coverage than most employer plans. But please note, if the employer plan is a high deductible plan paired with a health savings account, HSA, you'll need to make a choice. You cannot contribute to an HSA if you're enrolled in any part of Medicare. If this is the kind of plan you currently have, talk to your employer. You may be able to have a different plan, or you could always go off the employer plan and get all of your health insurance through Medicare. All right, so let's go back to our initial question. If you're over 65 and working, does the employer plan cover 20 or more employees? If the answer was yes, we saw that you can delay enrolling in Medicare, but you should talk to your employee benefits administrator. But what if the answer is no? If your employer plan covers fewer than 20 employees, you must enroll in Medicare at age 65 in order to have complete coverage and avoid penalties. Remember the table we saw earlier of who pays first? If you're over 65 and covered by an employer plan that covers fewer than 20 employees, Medicare pays first, but you must be enrolled in Medicare in order for Medicare to pay. Okay, so number one, you have to enroll in Medicare if your employer plan covers fewer than 20 employees. Also, you want to talk to your benefits coordinator because your health insurance at work may be different. Unlike the insurance you had before age 65, your insurance now will be designed to coordinate with Medicare. You may want to keep the employer plan for supplemental coverage to fill in some of the gaps Medicare doesn't cover. But since Medicare will be the primary payer, you'll need to enroll in parts A and B of Medicare. A covers hospitalizations and part B covers doctor bills and procedures. Drug coverage works a little bit differently. If your employer plan offers coverage that's at least as good as Medicare's, called creditable coverage, you can keep that plan for your drug coverage and do not need to enroll in Medicare Part D. Your insurance company is required to give you a statement each year certifying that the plan is creditable. As long as you have that, you can delay enrolling in Part D and you'll not be charged a late enrollment penalty if you enroll later. If you ever lose your employer drug coverage, you should not go more than 63 days without coverage. If you do, you may be charged a late enrollment penalty. Okay, so I've just given you the rules for when you need to enroll in Medicare and when you don't. Specifically, if you're 65 and working and your employer group plan covers 20 or more employees, you can stay on the employer plan and don't need to enroll in Medicare. However, my advice to everyone turning 65 is to call the Social Security Administration and ask them if you need to enroll in Medicare. If you're working and covered by an over 20 employee plan, they'll say no. You should make a record of that conversation, the date, the name of the person you talked to, and a summary of that conversation, and keep it for when you eventually enroll in Medicare. There have been cases where people were advised by someone other than an SSA representative, say an insurance agent or an employer, not to enroll in Medicare, and then the person was charged late enrollment penalties. If you happen to get wrong advice from SSA and are charged later charge penalties, you can seek equitable relief, but only if that bad advice came from SSA, not from anyone else. If you're not working or are covered by an under 20 employer plan, SSA will tell you that you do need to enroll in Medicare and you should take their advice. And here's the penalty I just referred to. If you don't enroll in Part B when you're supposed to, you'll pay a 10% penalty for every 12-month period that you should have been enrolled. So if your Part B premium is $148.50 and you pay a 10% penalty, your premium this year will be $163.35. If premiums go up next year, you'll pay that premium plus 10% of that amount, and so on for the rest of your life. So it's not just a one-time penalty. You don't want to pay this, obviously, late enrollment penalty, which is why it's critical to get SSA's guidance when you do turn 65. We saw that earlier table where COBRA pays secondary to Medicare, but I want to bring this up again because it's quite common for employees to go onto COBRA for 18 months after leaving employment. The thing to remember here is that COBRA is not considered an over 20 employer plan. If you don't enroll in Medicare within 8 months after your employer insurance terminates, you may be charged a late enrollment penalty. Some of the people have come off of COBRA after 18 months and found that they couldn't go on to Medicare right away. They had to wait until the next general enrollment period between January and March, with Medicare not starting until July. And this caused a gap in coverage and late enrollment penalties as well. Okay, so now that you're clear on whether or not you need to enroll in Medicare and when, let's talk about how actually to enroll. And it really couldn't be easier. You just have to go to medicare.gov and click on Apply for Medicare. The online application process, it's very easy, and you're actually guided through it. And I should say that if you're receiving Social Security when you turn 65, you'll automatically be enrolled in Medicare Parts A and B. You can decline if you wish, but the only reason to decline Part B would be if you're working and covered by an employer plan that covers 20 or more employees. If that's the case, you probably haven't filed for Social Security yet. And and if some people don't like enrolling online, another way to enroll is to call the Social Security Administration at 800-772-1213. Okay, now let's talk about how private insurance works with Medicare to provide complete coverage. So even though Medicare is a government program, it's based on a private insurance model involving deductibles and co-insurance amounts. It doesn't pay for 100% of your care. And the Part D prescription drug plan looks to private insurance companies to provide the actual insurance. So enrolling in Medicare Parts A and B, you're not done. It doesn't finish the job. You also need to find a private insurer to cover your drugs and pay for some of the deductibles and co-insurance amounts for hospitalizations and doctor bills. So here are some of the ways you can fill the Medicare gaps with private insurance. First, look to see if you have employer or retiree insurance that works with Medicare. If so, you may want to keep it, but make sure the drug coverage is creditable. That means it's at least as good as Medicare's basic drug benefit model. Your plan will know if it provides creditable drug coverage, and it will give you a statement to that effect. If it's not creditable, which may be the case with some high deductible plans, you should find a standalone prescription drug plan on the open market. Remember, if you go more than 63 days without creditable drug coverage, you'll pay a late enrollment penalty when you finally do sign up for Part D. If employer or retiree insurance is not available to you, you have two choices. You can take out a Medicare supplement policy, which is also called a Medigap policy, and pair it with a prescription drug plan, or you can enroll in an all-inclusive Medicare Advantage plan. Medicare Advantage plans they're like HMOs that involve a network of providers that deliver your care. And one thing to note is that whether you take out a Medigap policy or enroll in Medicare Advantage, you still must enroll in Medicare Parts A and B. Okay, so choosing between a Medigap policy and a Medicare Advantage plan, it's not always so easy. And once you've made that decision, you have to decide which Medigap policy or which Medicare Advantage policy to go into. So it's another reason why the transition to Medicare, at retirement, it's tricky. When you were working, your employer negotiated with insurance companies and narrowed down your selection of plans. Usually have maybe 3-4 different plans to choose from. After you retire and go on into the Medicare world, you're basically on your own. There'll be many plans available to you, but it'll be up to you to choose the best plan for your needs. So here are some of the things that you want to consider. First, can you see the doctor you want to? Some Medicare Advantage plans have rather narrow networks. If you go into one, you may not be able to see the same doctor. Same with specialists. To keep costs down, some Medicare Advantage plans are excluding the very specialist you might want to see if you encounter a serious diagnosis. With a Medigap policy, you can see any doctor that accepts Medicare, and you're not limited to the insurance, an insurance company's network. Another consideration is how much will you have to pay for your medications. Drug plans differ widely in what they'll pay and what they require you to pay for different types of drugs. So when you're shopping for a drug plan, you'll want to take your own drug regimen into account and see how much you would pay under each plan for the drugs that you're currently taking. If you don't take any drugs on a regular basis, you can just go with the plan charging the lowest premium, and you can always change it later. Okay, then another consideration is, what are the monthly premiums? Medigap policies tend to charge higher monthly premiums than Medicare Advantage plans, but you can't look at the premiums in isolation. So, choosing a plan based strictly on the monthly premium, it could come back to haunt you in the end. Plans that charge low premiums often have higher out-of-pocket costs, such as co-payments for every doctor visit or high co-insurance amounts if you have to go out of network for your care. So be sure to take into account all the potential costs, not just premiums, based on your own healthcare usage when choosing supplemental insurance to go with Medicare. In addition to being prepared for all the work on handling your own insurance in retirement, you also need to be prepared for the cost. Unfortunately, many people retire without knowing how much they'll pay for health insurance and healthcare in retirement. As I mentioned earlier, when your employer is subsidizing your premiums and when your cost sharing amounts are taken right out of your paycheck, you may not even be aware of what you're paying while you're working, but it will definitely be different after you retire. So let's take a quick look at it. Here are the items you have to budget for in retirement. First are your monthly premiums for Medicare and for whatever supplemental insurance you choose. Second are the out-of-pocket costs for healthcare. These include deductibles, co-payments, co-insurance amounts, and these are the gaps not covered by insurance. Some of the gaps left by Medicare can be covered by supplemental insurance, but often not all of them can. There will also be out-of-pocket costs for non-covered services, things that Medicare and supplemental insurance don't cover at all. This table here, it shows Part B and Part D premiums for the different income levels. If you're single and your income is under $88,000, or if you're married and your income is under $176,000, you'll pay the regular Part B premium of $148.50 per month. There'll be no income-related adjustment. Your Part D premium will vary, but if you pick a plan that charges the average premium, you'll pay about $40 per month for a total of $188.50 per month, and that gives you your Part B and Part D coverage. If your income falls into one of these other tiers, you'll pay an income-related adjustment on top of that base premium. For example, if you're in the second tier, you'll pay an extra $59.40 for Part B and $12.30 for Part D on top of those regular premiums. This will bring your total up to $260.20 per month. Keep in mind that these are per person, not per household. So if you're a couple, you can double these amounts. Your tax return from 2 years ago is used to determine this income-related adjustment. For example, the adjustment for 2021 would be based on the income reported on your 2019 tax return. And keep in mind that the premiums shown here, they don't include premiums for Medicare Advantage or Medicare supplemental plans. This is just for Part D, Part B, and Part D. To give you an idea of what you may pay for supplemental insurance, I've indicated some typical amounts here. So we have $200 a month for your Medigap policy, plus another $40 for your drug plan, or about $50 for a Medicare Advantage plan. You can find plans with fewer benefits at a lower cost, as well as plans with more benefits at a higher cost. Choosing a plan based on your, you want to choose a plan based on your own expected healthcare usage. That's what you're tasked with in retirement. But if you just want a ballpark idea of what you might pay for health insurance after retiring, you can plug these numbers into your preliminary budget and make adjustments later as things become clear. If you have good supplemental insurance, your deductibles and co-insurance amounts for hospitalizations and medical services, they may be mostly covered, but there still may be co-payments each time you visit the doctor or get your prescription filled. And then there's services that Medicare doesn't cover and that Medicare policies don't cover either. These include dental care, routine vision and hearing care, and alternative care such as acupuncture or chiropractic care. Some employer or retiree plans do cover these services, and some Medicare Advantage plans cover them as well. But if you choose a plan that's right for you in other ways but doesn't cover these services, you'll need to incorporate these costs into the budget also. So here's a sample budget showing monthly premiums only. And this is for an individual who's not subject to the income-related monthly adjustment. So they're just paying the base Part B premium of $148.50 per month. Their Medigap policy will be $200 a month, and their drug plan will be $40 a month, for a total of about $388 per month. How does this compare with what you're paying for employer insurance now? Is it lower, higher? Some people save money while going on to Medicare, others spend more. It just depends on how generous your employer was while you were working. Here's a sample first-year budget taking into account premiums and other out-of-pocket costs. So this would be for a person who has the most comprehensive Medigap policy. There would be no deductibles or co-payments under this plan, but there would be out-of-pocket costs for dental, vision, alternative care, and some miscellaneous costs. And these costs vary per person. Yours may be higher, but for now, we just want to get you thinking about what your own first-year healthcare costs might be, and to not retire until you know how you're going to pay for them. Okay, so I know that everyone is in a different place with regard to retirement. Some of you may already be retired, others are planning far ahead, and then for some it may be next year, this year, or in the next couple of years. The first step is to determine your Medicare effective date. This will either be the first of the month you turn 65, or if you're still working and covered by an employer plan that covers 20 or more employees, the month you go off of that employer plan. 3 to 5 months before that effective date, find out if you'll have employer or retiree insurance available to you and understand how that insurance will work with Medicare. If you're keeping the employer or retiree insurance for supplemental coverage, enroll in Medicare Parts A and B. Ask the plan about enrolling in Part D. If the plan offers creditable drug coverage, you may not need Part D, but don't enroll in Part D unless instructed to do so by the plan. If you're not keeping employer or retiree insurance, decide between a Medigap policy paired with a prescription drug plan or a Medicare Advantage plan. And it's important that you shop for plans. Choose one and apply for the coverage starting on the effective date. Enroll in Medicare Parts A and B starting on that effective date. Once you've made the transition to Medicare, your job's not over. Some Medicare plans change every year. Medicare Advantage plans change their pricing and terms based on their outlook for healthcare costs in the year ahead. They may raise the premiums, or they may kick a doctor or your particular doctor out of the network. It's very important if you have a Medicare Advantage plan to review the materials when you receive them in the fall and make your decision between October 15th and December 7th of each year as to whether you want to stay in the plan or switch to a different one. And that October 15th to December 7th, it's effectively your Medicare open enrollment period, which is why we're trying to put this webinar out, timely coinciding with that. If you had decided to go with a Medigap policy, that policy itself won't change, but the drug plan you choose to go with it might. They might start charging you a different amount for the drugs that you take. So because of that, it's important that you review your drug plan materials each fall and decide if you want to stay with the same plan or switch to a new one for the next calendar year. Remember, reviewing your existing plan is only part of it. New plans come onto the market each year, so you want to see what else is out there before deciding to stay with your current plan. The insurance companies know that most people tend to stay with their same plan, so they use little tricks like upping the co-payments or raising the premiums while offering more attractive plans to new buyers, assuming their existing members won't bother to look at the newer plans. You have to be vigilant in the Medicare world, or you'll end up paying more than you really should or more than you need to. Okay, so that brings us to the end of the webinar. We're committed to putting on educational webinars. We've done over 15 this year and have plans to continue into next year. We've done webinars on Social Security, estate planning, retirement income, and other financial topics. You can watch webinars we've done or register for upcoming ones at our Learning Center, where you see that, which is on our website, which the link is above. Today, I talked about putting together your first year healthcare expense budget and also trying to project out your lifetime health costs. And in January, we see a renewed interest every year about budgeting and personal finance. So one of the webinars we have on the dock for January is how to put together a healthcare budget. I'm really to go into detail on that because it's one of the things that can change over someone's, retirement. When they first start, they may project what they're going to spend, but the healthcare world changes so frequently that it may really be different than what they expect it would be. So again, thank you for joining us. If there are any questions, I'd be happy to answer them now. Also, we offer a specific, if you want to set up a complimentary consultation, we offer that as well, which you can schedule at bautisfinancial.com/call off of our website. If you have something specific about Medicare or retirement or any other financial topic, we'd be happy to talk about that as well. Kira, do we have any questions right now?
Hey, Mark, there's no questions in the chat today.
Okay, so again, thanks everyone for joining, and hopefully we see you on one of our upcoming webinars.